support.
This week, the Uganda Bureau of Statistics unveiled a survey indicating that about 17 million people are multidimensionally poor. This report looks at other aspects of life other than the income indices. Dr. Fred Muhumuza of Makerere University says more is still needed to understand aspects of life than what was captured in this latest report.
People would say, well, I am unable to access justice. And some of these were not financially poor in terms of money. But as you know, the court system can block you out whether you have money or you don't have the money, maybe because of an investigation that cannot be done. So it's not just the court system. You're supposed to go there with a good report that police has made. Police is not able to make that report. Reading their report, you still would wish they had done more. So it is true that the poverty based on income is inadequate because money facilitates processes.
Dr. Muhumuza shares a similar view with Richard Sewachirianga, a senior research fellow at the Center for Basic Research.
Variables like powerlessness, variables like insecurity, variables like shame, variables like isolation are things that are still important to people.
A disease comes and everybody is locked down. So whether you have money, you have a car, you just can't move. Even those who had lots of money, you want to access a hospital facility. This is the time we discover there is no oxygen in hospitals. But this has been happening to so many people, but at a more smaller scale, that you go to a hospital and there's no oxygen. Go to a hospital, there's no blood. Now, even if you have the money, blood is not there. People would tell you, majority of them are able to reach the health facility in 30 minutes. Now, that does not necessarily mean the health facilities are many. But because over years and over time, some are coming by border, which have increased, and they are really available among the population. Some come by car, they are available. But their major complaint, which we also asked as a question, was how long does it take you to see a doctor or a health worker after you have reached the facility? Now, for some people, that time was 6 hours.
The Multidimensional Poverty Index survey comes in the wake of a government insistence that the country had morphed into a middle-income state.
At the end of the day, you don't want to praise yourself when the people don't feel it. The basic thing we are saying, how are the people benefiting? The inclusiveness, the participation, and the reaping of the benefits, sharing of the benefits of that economy, which is the whole conversation about the Sustainable Development Goals of the UN.
Since 1992, Uganda has invested trillions of shillings in poverty reduction strategies, like the formulation of Uganda's Poverty Eradication Action Plan, PEP, focusing on northern Uganda, Karamoja, Luwero Triangle, among others. But these programs seem to have done little to realize the intended objectives.
Meeting years of schooling or school attendance requirements does not guarantee that one has become literate. What guarantees that one has become literate is the cognitive skills that have been gained and how those can be measured.
People are saying if you don't have toilets, you suffer from a number of health-related diseases, which increases the cost.
JJINGO FRANCIS, NTV.